Hi, it's Dr. Lee. So today I will be talking about brow lifts. So brow lifts address the position of your eyebrows. There are many ways of doing a brow lift, really depending on multiple factors, including your gender, your hairline, and exactly which parts of the brow you want to be raised. As we age, it is very common for the brows to start drooping. More so on the outside than the inside, but they do droop overall. It depends on your genetics, also the quality of your skin. If you're younger and you have just a little bit of drooping, one of the non-surgical options would be to use Botox. By releasing the muscle around the eye, it actually relaxes and releases the tail of the eyebrow, and you get a nicer arch of the eyebrow and a small lift. Another non-surgical option would be thread lifts. Thread lifts use barbed absorbable sutures, which are placed underneath the skin to essentially hook onto your skin and pull it. And over time, as they dissolve, they're replaced by collagen. And the goal is to have your collagen hold up your eyebrow. Over time, as we get older, the brows may continue to descend with gravity and just relax and lower quality of skin. In the case, we actually have to address the issue. So we do sometimes have to cut out some extra skin and also reposition some of the muscles as well. The incisions can be made anywhere from directly in your eyelid crease, on the eyebrow, one of the natural creases that you may have in your forehead, or anywhere in your hairline or beyond. So there's a lot of different options that can be custom tailored in order to hide the scar on your face. So depending on the age and gender, brows are going to look and be positioned differently. The most important thing is that you have stable eyebrows, meaning if you were to use a finger and try to move your eyebrows a lot, they don't tend to move all around your face. If you find a lot of extra movement, then you may be a good candidate for a brow lift.